Pregnancy is a life-changing moment for any women. Understanding these changes is very important. If you are pregnant right now and if you know how your body is going to change, how your environment is going to change, what are the emotional changes that are going to happen, it becomes much more easier for you to cope up with all these changes. Sometimes these changes are good and sometimes these changes can be frustrating. In today's video, I would be sharing some of the changes that happens in the body. This information will help you out in understanding how the body changes in the course of pregnancy, what are the clinical implications or else health impacts that happens following these changes, and how to deal with it. So without wasting any due time, let's get started. Sit down. Following changes happens in the body due to pregnancy. These changes are weight gain, changes in urinary system, changes in your pulmonary system or else in the breathing pattern, changes in your cardiovascular system, also you can say changes in your blood flow and how the heart functions. Changes in your musculoskeletal system, which means the way your muscles, ligaments, tendons functions also changes. Changes in the thermoregulatory system and also changes in the way you sit stand, which means there are postural changes. At the same time there are changes in your balance. So now let's understand in a bit more detailed way what are these changes. So let's first talk about weight gain. This weight gain could range between 25 to 27 pounds. Apart from that, individually also there are significant weight changes, especially in structures like placenta. Placenta weighs around 0.48 to 0.72 grams, whereas the baby weight or else the fetus weight increases from day 1 till the end of the pregnancy to 3.36 to 3.88 kgs. Many a times due to early delivery, the child might have a low birth weight, and even some full-term pregnancy also birth weight less than this. Amniotic fluid also increases, so does the weight of the amniotic fluid increases. This increase in the weight is around 0.72 to 0.97. The uterus and breast increases and weighs up to 2.42 to 2.66 kgs. When you look at blood and fluid, both together increases in the weight around 1.94 to 3.99 kg. So this was about weight gain. Now what are the changes in the pelvic viscera? So pelvic viscera is nothing but your uterus where your baby is growing. The changes that happens in particular area is, first place, uterus grows by 5 centimeters to 10 centimeters, and in height it increases by 25 centimeters to 36 centimeters. Moving to the urinary system, kidneys increases in its size by 1 centimeter. As the uterus enlarges, it also enters the urinary bladder and pressurizes it. This is the reason there is more regurgitation of urine and there is more chances of development of urinary incontinence during this period. Moving to the next system, which is pulmonary system. The changes that happens in your chest is there are more chances of edema and tissue congestion in the upper respiratory tract. This particularly happens following hormonal changes. There is also changes in the rib position. There is 15 to 20% increase in the consumption of oxygen, and this particularly happens to meet the demand of oxygen not only by mother but at the same time of the fetus. The next change is about the cardiovascular system, or else you can say heart and the blood circulatory system of the body. The blood volume progressively increases by 35 to 50%. It happens throughout the pregnancy. There is increase in the plasma level in the bloodstream. This increase in plasma level basically leads to physiological edema. Compared to the RBCs or else the red blood cell formation, there is more production or else more increase in the amount of plasma level in the body, which shows that mother is getting anemic. But this is a temporary change and this doesn't come under the category of pathological anemia. This is just a physiological change and gets recurred or else recovered following time. Heart size increases and even the heart position changes. Heart ratio increases by 10 to 12 beats per minute. Blood pressure decreases, especially in the early phase of pregnancy, but many women develop develops physiological hypertension in the late stages of pregnancy. Moving to the musculoskeletal system changes, the first change that happens is abdominal muscles gets more lax and stretches out. There's increase in the flexibility of the ligament, the joints become more hypermobile, and the pelvic floor muscle drops by 2.5 centimeters. Next change is in the metabolic system. Basically, the basal metabolic rate gets slower during pregnancy. A mother needs extra 300 calories every single day during the time of pregnancy. This is particularly needed to suffice the demand of the body's increased metabolic rate. There's also increase in the fasting blood sugar level. Moving to the last change in the body, and that is posture and balance. Definitely, as the baby is growing, abdominal muscles are stretching, there is loss of tensile strength of the ligaments, there would be obvious postural changes and balance changes in mother. Some of the common changes that are very evident during pregnancy is the shoulder gets forward bended and the upper back becomes rounded, which looks very much like an hunchback posture. There is also chance for a mother to develop forward head posture during pregnancy. This particularly happens in order to match the shoulder alignment. The lumbar lordosis, or else the curvature of your lumbar spine or else low back region, increases as the baby is growing in the abdominal region, and even the pelvis gets more wider. Moving to the changes in the balance, the ability to do activities like walking, stooping, climbing stair gradually reduces in its speed. Also, the mother would try to walk with more wider base of support, but all these changes last only during the period of pregnancy. Once a mother delivers the baby, gradually the body starts coming back to its pre-pregnancy state. These changes can have a lot of health implication in few mothers. Hence, it's very important to be very careful and to watch out all the signs and symptoms, especially the red flag signs that your doctor has suggested to watch out for during this period. I hope you found this information helpful. May this information help you to have better dialogue with your doctor, also gives you an understanding about what to expect, what kind of changes to expect during the phase of pregnancy, and gives the strength to cope up with all these changes. So friends, this was all from the HealthQ side. This is physiotherapist Meghna Dave from HealthQ signing off. See you next week. Bye-bye.